Tomorrow, major changes to the state's 340B medication program will take effect. It currently offers federal reimbursement to health centers for their expenditures on medication for patients. But tomorrow, the state will take control of that program. Now, local health center Evergreen is suing the state in an attempt to block that transition. But local pharmacists are in support of the new program, saying that it will only help increase access to medication for patients.
We are being very clear. We serve these patients too, every bit as much as the 340B entities. And we need New York RX to remain in business and continue to serve these communities.
Pharmacies say that the changes will give more than 8 million New Yorkers access to medication that they need. Now to a push to help save lives amid the opioid epidemic that's impacted millions of American families. This week, the FDA approved over-the-counter sales of the overdose reversing naloxone. Now, the hope is that by increasing access to the medicine, it will decrease the number of overdose deaths. Now, according to the National Institute of Health, nearly 107,000 Americans died of overdoses in 2021. More than 80,000 of those deaths involved opioids. And we just learned just last week that nearly 300 people in Erie County lost their lives to opioid-related overdoses last year. So tonight, I caught up with a local pharmacy to see how this new resource can help save lives in our community.
It's a wonderful opportunity to provide this life-saving medication.
The Food and Drug Administration approving NARCAN, a nasal spray for over-the-counter non-prescription use. It's something pharmacists are calling a game changer.
It becomes a breathing issue. They stop breathing because of the high levels of opioid in their system, and they go into cardiac arrest. And what this does, again, by inhaling this, the nasal spray, it will go into those opioid receptors and reverse that effect. And hopefully within 2 to 3 minutes, the patient will start breathing again.
Brighton Eggert Pharmacy in Tonawanda has been providing naloxone spray for quite some time. Owner Don Arthur says the pharmacy has been treating 6 patients per day for the last 3 months.
When there's a suspected opioid overdose, people should not hesitate to use this product. It's a spray. It's very easy to use. You can use it on a patient who's unconscious or semi-conscious. And if it's not an opioid overdose, fortunately, this particular chemical medication will not cause any harm.
One way Erie County health professionals are trying to curb the number of overdoses is by meeting people where they're at.
One of the things we learned were different areas of the community where services necessarily weren't easily accessible. So from that, we've been doing pop-up events, utilizing the Live Well Erie van.
The Erie County Opiate Epidemic Task Force was established in 2016. Since then, along with NARCAN, officials have been offering screenings, COVID-19 vaccines, and harm reduction supplies. The pop-up events take place 3 times a week. On Tuesdays, curbside care takes place in downtown Buffalo at 158 Pearl Street from 11 to 3 p.m. Thursdays, the task force occupies the St. John Canty Church parking lot with available resources from noon to 3. Fridays are a little flexible, making visits to different communities on a need basis.
We do have some repeats that come in, but we also have many people that we never in any other time would interact with. So it's been able to spread the message much broader than we would have been able to.
You can anticipate pharmacies to house the life-saving medicine in their stores late this summer.
If it is a barrier for you to go to the drugstore and pay for it, you can always get it from us here at the county.